Yeah. Can you hear me?
Yeah, we can hear.
Yeah. Hello, everyone. It's great to be here celebrating contribution of women in engineering. And I'm very honored and privileged to be invited to talk about the work that I've been doing in the last 3 to 4 years. Just a bit about myself. Thank you, Sadhana ji, for introducing me. Yes, I did my PhD from IISc, and 25 years I worked in Xerox and Hewlett Packard and other companies. However, when I was at my previous organization, 2 of my cousin sisters, I lost them because of breast cancer. So we started this startup called NIRAMAI, means being healthy in Sanskrit, trying to solve the biggest problem in women's health today, which is breast cancer. More than 500,000 women are dying because of breast cancer in the world today. The unfortunate thing is, many of them can live much, much longer, could have lived much, much longer, only if the cancer was detected early enough. In fact, in countries like India, the survival rates are just about 50%. Every alternate lady detected with breast cancer is dying. And this can be saved. This can be saved. These people can be saved if we can detect the cancer early. So the next question is, why are we not able to detect this particular cancer early? There are multiple issues, as you can see on the left-hand side of the slides. One is, of course, affordability, right? A 3,500 to 4,000 rupees test, which is about $20 test, is a huge amount of burden on many women when you're saying the lady has to go for a test every year. It's a lot of money. So, and also when you consider women in rural areas and all that, they cannot even afford it. This is almost their 1 month's salary. They cannot afford it. Accessibility is an issue because many small diagnostic centers do not have this machine at all, called mammography, which is the standard of care in most countries. So most women detect cancer by hand, accidentally, when there is a lump, when there is a huge lump, in fact, that they cannot anymore, hide. And there is also a technology limitation, which makes it difficult to detect this cancer early, globally, not just because of affordability or accessibility. It is a global problem that mammography, which is the de facto standard for detecting breast cancer, does not work on women under 45 years of age. And because it uses X-rays to screen cancer, the radiation effects have to be stopped. And so you can only do this test once in 2 years. What happens if the lady gets cancer between the 2 years? All in all, 90% of the ladies in the world today detect their cancer by hand in this technological era. How can we change this? And this is what we wanted to change as a startup, which we started 3 years ago. Our startup has now, which is called NIRAMAI, has now developed this new solution, which basically, and I'll talk a lot more about the technology, but basically it is able to detect definitely much before a lump is felt. In fact, to feel a lump, it has to be 25 millimeters in size, and we are able to detect at 5 millimeters, 5 times smaller, and 5 millimeters is stage 0. Instead of detecting at stage 3, stage 4, we are detecting at stage 0. Very, very much possible to save the lady. Another important thing is that women are very shy to go in front of somebody else to disrobe and then get this test done, right? So we made the test completely privacy aware. There is a small booth. A lady enters into the booth and comes out after 15 minutes. Her test will be done. There is nobody inside the booth, not even a technician seeing her. And this non-contact, non-invasive, privacy-aware experience is a huge thing for women to adopt screening. Most of all, there is no radiation. All we do is measure the temperature on the skin. There is no X-ray or any radioisotopes that is inserted. I mentioned about mammography not working for under 45 years of age. This test does work on all age groups. We were unfortunate to detect a 17-year-old cancer patient, girl, with this. Of course, it works on men too. Men also get breast cancer, though the cases are lower and mammography doesn't work, and that can work here. Finally, yes, we made it very affordable to the extent that it can be used in rural areas for 100 rupees per test, $2 test. Or, of course, we can have a more detailed report to say exactly where the problem and so on. even at one-third the cost of a mammography in a most sophisticated diagnostic center. And most of all, we made it very portable. It's like a half a liter water bottle, and a person can put the machine behind the backpack, go in a bike, and then go to a village and do the screening. So all this was possible because of technology, because of the latest algorithms that we have developed using machine learning and artificial intelligence. And I'll say a little more about this now. The technology we have developed is based on machine intelligence and a sensing technique called thermography. We call this as thermalytics. So when a person goes into this booth I mentioned, there is a thermal sensor that is placed. It measures the temperature variations on the skin. A thermal sensor is very famous today because of COVID, right? You see many people in the airports being screened for fever using this test, using this sensor. It's the same sensor, completely no side effect, no radiation, safe device. And that is what we use to measure the temperature variations on the chest. Now the magic comes in. That is, we analyze these temperature variations using a software, NIRAMAI software, which has this machine learning algorithms built in, and automatically it analyzes and figures out, here is the problem, this is the area, this is the probability that it is malignant, and all that automatically within 2 minutes. And of course, this is novel. Otherwise, it would be there earlier. Nobody else in this world has this technology. We have 9 granted US patents, not just applications. They have been granted in the US, and we also have applications in many other countries in Europe as well. The key thing is we are not trying to find lumps, because lumps can be harmless. We are trying to find abnormal tissue activity. When there is a tissue activity which is abnormal, like cancer, it divides at a much, very detailed rate, higher rate, and that results in an increase in temperature, and that is what a thermal sensor can catch. However, not everything that's hot is cancer, and that's where machine learning helps. These are some of the granted patents. And what's the core innovation? The core innovation is in the ability to detect whether a red spot, a little bit hot spot, is cancer or no cancer. You can see 4 different women here. The bottom 2 are not cancerous, but still they have red spots. And using machine learning and many of these parameters that we have mentioned here, we are able to identify that only this lady is cancerous and none of them are. This is very important. When 100 people walk in for screening, you cannot call 60 people as cancerous, because 60 people will have a red spot because of a cyst, because of hormonal reaction, several things. And that needs to be differentiated, and here is a test which can do that. And there's many other interesting machine learning aspects that we do here. Like, for example, this test can be done by real, nursing staff, health workers who may make a lot of mistakes. Finding out that whether the mistake is there or not is all image processing and machine learning, deep learning based algorithms that we use, and several other areas where we use machine learning. And this has resulted in several international technical publications and also clinical publications comparing how the thermalytics test performs with respect to mammography or any other test that's out there. So overall, this is a computer-aided diagnostic with artificial intelligence and machine learning. And the automated generated report, it is completely automatically generated, 3-page report, has many scores and markings like I mentioned before. Again, completely automated. This goes to a radiologist mobile and he can certify that it is correct or not. However, when we go to rural areas, there's no doctor, there's no radiologist. So that is where we automatically give a red, yellow, green, like this. You see a red saying follow up with ultrasound. So this is automatically again given within 10 to 15 minutes for the health worker to decide whether the lady needs to be brought to a hospital or she's safe. This is how it looks. It's a very small device and operated by any nursing staff. And it can also be done outside, like I mentioned, or in a mobile screening van called we have a Pink Express, which goes to rural areas to do the screening. At this stage, I would like to quickly play the video, which gives you an idea of the experience. So it's as simple as that. And you may have a question in your mind saying, is this applicable only to breast cancer? No, this is applicable to several other types of cancers, but we are starting with breast cancer. It can be applied to non-cancer issues such as pain management and sports injuries as well. This innovation has led us to multiple awards and media mentions. And the most important one I'm very proud of is to put India on the AI world map. We're the only Indian startup listed on the top 100 AI startups in the world. Thank you very much for listening to our story. NIRAMAI, saving lives with many AI technologies. Happy to answer your questions.
Yeah, I think we will, thank you, Dr. Geetha Manjunath. We will take the questions maybe at the end. So it was really,
Sure.
Yeah, thank you for taking us through the non-invasive method of detecting the breast cancer. It's really a boon to all women out there. Those who have done mammography, they'll really understand the pain of it, and this is really a boon to all. Then our next speaker is Ms.Loulia Kaseem. Ms.Loulia is the founder and CEO of RIA from Lausanne, Switzerland. She is a passionate entrepreneur with a focus on women's healthcare. Loulia has a double degree in pharmacy and biotechnology and is a former founder of a pharmaceutical company. Her product is Smart Pad. RIA develops a Smart Pad to allow home monitoring of women at risk of preterm birth. Over to you, Ms. Loulia, for the talk.
Thank you. Thank you very much. First of all, I would like to thank you for inviting me to talk today. I'm pretty thrilled to be part of this webinar. And I'm gonna start right ahead. Please let me know if you can see my screen, if you can hear me.
Yes, yes, we can hear you.
Yes, we can see your screen also.
Perfect. So hello everyone again. My name is Loulia Kaseem. I'm the co-founder and CEO of RIA. Let me start by explaining a bit of why we work on premature birth. Premature birth is the first cause of death of children worldwide. The survivors of these neonates face problems like cerebral palsy, cardiovascular issues, respiratory issues, impaired learning, hearing, vision and dental problems, and chronic health issues. What causes preterm birth? Until today, this is a vague subject in science. However, it's believed that lifestyle, like for example, if the mother is a smoker, increasing maternal age, in particular above 35 years, previous preterm birth, certain health problems like hypertension and diabetes, and stress. To highlight how big of a problem it is, today, 10% of all babies worldwide are born preterm, and the number is only on the rise. Only in India, yearly, there is 3.5 million babies born preterm. As for women, it is quite hard to get tested for a risk of preterm birth. Now, why is that? Today, all methods for preterm birth diagnostics are invasive. They need a hospital and a trained physician. However, upon a detected risk of preterm birth, these women have to spend long periods in the hospital only for monitoring reasons. And sometimes these periods may go up from weeks to several months. And the most shocking part about this is that among all of these women hospitalized today, only 30% of them will actually deliver preterm. While on the other hand, almost half of all preterm babies are completely unexpected and not even diagnosed. With our technology, we want to allow pregnant women to detect the risk of a preterm birth from the comfort of their home, safely and effectively. We're developing the first technology for home monitoring of preterm birth. The SmartPad has an embedded sensor. This sensor is capable of collecting vaginal secretions of pregnant women and screening simultaneously for 3 different proteins that are indicative of a risk of preterm birth. The SmartPad is also wirelessly connected to a phone app that allows the doctor to detect the risk of preterm birth remotely and monitor their patients. It's quite easy to understand. It's also easy to use. All a pregnant woman has to do is to wear the pad for a couple of hours. Then the phone app will collect the test results. The test results will be sent automatically to the doctor through Rhea's phone app, and then the doctor will decide whether the pregnant woman has to stay home or if she has to be admitted to the hospital. So our value proposition is quite clear. For pregnant women, we're offering a self-test from home. There's no need for invasive diagnostics in the hospital, no need for long hospitalization, and of course, the overtreatment with medications that comes along. And of that, I mentioned the antenatal corticosteroids that are administered to these pregnant women, mostly because doctors are concerned of the preterm birth risk, and they mainly give it in order to allow the organs of the neonate to develop, in particular the lungs. As for obstetricians, we're giving them a pretty easy and efficient test that fits in their clinical workflow. Sample collection is greatly simplified. They are able to do multiple biomarker testing. And last but not least, they are reducing the use of antenatal corticosteroids, which has, of course, been proved to have more risks than benefits when the woman ultimately delivers at term. So not only pregnant women and doctors do benefit from our technology, but also hospitals and insurance companies. Hospitals will be able to free beds for patients in real need for hospitalization. And for example, in Switzerland alone, insurance companies might save up to almost 30 million francs per year. So how does our business model work? Key opinion leaders in obstetrics worldwide will recommend the SmartPad to their patients. Then we will reach pregnant women directly online through Rhea's website. We plan to sell 3 months of home monitoring. And of course, today, more than ever, we see the need for home monitoring technologies. Imagine being pregnant or having a pregnant wife. I don't think any of us would like to spend such long hospitalization periods in the hospital. So who are we? We are a Swiss startup based in Lausanne. We are a group of scientists, and we're very passionate about the product and working very hard to bring it to the market as soon as possible. Who are the founders? My name is Loulia. I'm the co-founder and CEO of Rhea. My co-founder is Eric Garcia. He's the technology inventor. So let me tell you a little bit how this whole thing started. I met Eric in EPFL in Lausanne, Switzerland. He had the idea of the SmartPad, and I was quite inspired by the idea, and we were motivated to find an application for it and to bring it to the market. A little bit about myself. So I have a bachelor's in pharmacy from Damascus, Syria. For my bachelor thesis, I worked on women healthcare technologies. In particular, we studied hematological and plasma biochemical parameters, which was, of course, more of a motivation for me to continue on the path of women healthcare. Afterwards, I also founded my own business where I created a pharmaceutical company that imported and marketed the medicines all around Syria. Afterwards, I came to Switzerland to perform my master thesis, and it all started from there. And today, on this special day for women engineers, I'd like to take the chance to encourage all the women engineers listening to me. If you have an idea, if you have some passion to bring something you have discovered in the lab, in your master thesis, in your bachelor thesis, or even while sitting at home, if you think you have a brilliant idea, go ahead, talk to people about it, try to test it, be courageous, and go for it. And in the end, I would, of course, like to thank Swissnex India for this kind invitation, and AIT India also, because we have had the chance last year to visit India and to visit many hospitals in India to get feedback for our technology and the need for it. Thank you so much.
Thank you, Ms.Loulia, for sharing your thoughts about the smart pad with embedded sensor and connected to internet, which allows doctors to remotely monitor pregnant women. It is really a boon to all the pregnant women. And we will take the questions during the question and answer session. Now, next is the panel discussion with both the speakers of today. The panel will be moderated by Ms. Silvana Rengli, Deputy Consul General, Swissnex India. Over to you, Ms. Silvana.
Thank you very much. Can you hear me?
Yes, we can hear you.
Very good. Thank you. Okay, thank you so much. So I just want to quickly introduce myself. My name is Silvana Rengli. I'm the Deputy Consul General of Switzerland in Bangalore and of Swissnex India. As Swissnex has briefly been introduced, I just want to say a few words about. So Swissnex is actually an initiative of the State Secretariat for Education, Research and Innovation and part of the Confederation's network abroad managed by the Federal Department of Foreign Affairs. Swissnex wants to bring Switzerland and India closer together because we believe that the spread of know-how and the share of know-how and experience shouldn't know any borders. Swissnex supports, connects, catalyze and create stakeholders for startups, innovation and innovation-driven companies, but also for higher education and research institutions, for governmental and public funded institutions, and also for creative industries linked to education, research and innovation. I would like to give a big thank for the presenters, for the ladies, for these nice presentations. Today, on International Women in Engineering Day, we had the opportunity to learn not only from your remarkable careers as women engineers and entrepreneurs, but also your contributions to women well-being. Now, I'm happy to take you through the panel discussions. So I personally believe that there is an increasing awareness in companies and institutions in both Switzerland and India for women in science and technology areas. Also important strides have been made, but there is still more to be done. I will ask you the questions, and I think alternatively you can answer them. So first, I would like to talk a little bit about your career and the challenges you have learned from. If you would have the opportunity to mentor another woman, would you consider it? And yes, what will you do differently compared to your career? Would you like?
Is it?
Yeah, please go ahead.
Sure. Yeah, sure. So, yeah, mentoring is always important. And there are two kinds of mentors, I would say. One, implicit mentoring, like, role models, who may not be able to meet every day and so on. For example, to me, Dr. Geetha Manjunath, ma'am, right? She's a very well-known entrepreneur in biotechnology area, and she's MD of Biocon, right? So just seeing what all she does and so on and so forth, of course, I try to sort of meet her as well, once in 3 months. So that gives some kind of a high level direction on what can be done. Being a woman also, what else can be done, right? So that's one, implicit mentoring. Implicitly, right, we can get associated with, people who are in the field trying to sort of do this on a daily basis and reach out to them for different type of problems that we may face or dilemmas that we may face, right? So in my personal career itself or life itself, I consider many people as mentors, right? It's not like you go to one mentor for every sort of a problem. There are different types of problem. One could be like, how to raise funds. Another could be like, how do I get to this particular hospital, which is already using mammography? How do I position it? Another could be just sort of, here is my slide deck, how does it look? I mean, do I need to change anything? Whatever, right? And another would be, this is how the experience is. So for different people, you may want to go for different type of knowledge that you want to gain, right? Irrespective of whether a man or a woman who's doing it, right? So that's how I've always considered. Having that kind of a network to whom you can reach out to is very important. Personally, yes, I'll be happy to sort of, provide any, answer any questions based on whatever I have done so far, if it is helpful to any of the entrepreneurs who are coming up.
Okay, thank you very much. And Loulia, what about you? Loulia, can you hear us?
Hi, yes, can you hear me?
Okay, no, it's okay. Yes, thank you.
All right. So I think I would gladly mentor women and encourage them to take on entrepreneurial experiences. I think I wouldn't do anything differently, but maybe the tip I would give is to any to always be courageous to your mind, to challenge yourself, even if it's not the perfect condition. For example, if I'm talking to students, if they are still in their master degrees, if they are writing their master theses, don't think that you don't have time to take on responsibilities and to launch other entrepreneurial projects. Do it part-time, try it. You never know where it ends.
Okay, thank you for that motivation. So when we also talk about empowering women within your company, for example, gender equality and empowering women are rarely at the forefront of a startup's priority. So what leadership do you bring personally within your team?
Sure, I can go first again. In terms of gender equality and conditions around that, I would like to sort of take upon my, experience in my previous organizations in Xerox and Hewlett Packard and all that, where it's kind of more relevant, I guess, to the audience. I always say that, forget your gender. I think it's very, very important not to keep feeling I'm a lady, I can't do. I think that's one thing as a lady engineer, a woman in engineering. One thing is forget that you are a woman, right? That's when you are able to sort of, look at it completely from a technical perspective and then contribute, without feeling guilty or without feeling odd man, odd woman out. Because it's invariably true that if you go to a room, full of engineers, you will find fewer women engineers than male, right? And throughout my career, it's been this way that I'm the only one in the class, or in my master's in IAC, or sort of in a meeting, I'm the only lady. Everybody else, senior leadership would be male and all that. So then you suddenly start feeling I'm different. When you start feeling I'm different, you can't be yourself, right? So the first thing I would say is forget your gender, right? Because you're talking about technology. We are talking about things that need to be done by any gender. So that's one thing from a personal perspective. Secondly, also as a manager of a team earlier, I even at the time of hiring, right? I used to see some kind of, because women sort of speak differently. We all know that the expression of confidence is much lower in a women in India. It's a proven, literature will tell you that this is a proven thing, right? It's just the expression will be less. It doesn't mean they don't have capability or confidence. So, but what happens when you go for an interview and you have like multiple people, and the interview board also, is not with diverse opinions, then you try to sort of, select somebody who looks more confident than who knows more. Or when both are equal, you would try to sort of go for this. So, some of the principles that, for example, my previous organization used was like, I think it's called Wilson rule or something. This in Xerox, for example, the CEO and CTO both were women. They said that if you have a key position and you're shortlisting people, you need to shortlist top 5 people, and at least one of them should be a lady, whether you select her or not, right? You sort of make sure that she comes in with the top 5. No change in the rules, right? No change in the selection criteria or anything like that. And also, like I say that you need to look harder for a good lady engineer, because the number of engineers, lady engineers itself is small, right? So look at harder search, make that harder search, and make one person come in the top 5. Then, of course, whether she makes it or not depends also again on merit among the 5 people. So these kinds of sort of explicitly looking for talent, and believing that diversity helps. By the way, diversity does help inside a team to bring in diverse views, and so on. So then we can talk a lot more about it. So these kinds of principles are important. And just to end with my own startup, because it is on breast cancer screening, we find a lot of women who are interested in contributing to the cause of saving lives of women as well, right? So that way, in fact, in our company, we have almost 60 to 70% female as opposed to male. Of course, we have a wonderful, conducive environment of both genders. Thank you.
Okay, thank you very much. Loulia, what is your leadership to bring personality within your team?
I would say that I would put most efforts into recruiting people that have similar mindsets and do not have any gender-based limitations, whether they are males or females. I think that's the most important thing, because when you are passionate about what you do, when you are confident, it doesn't really matter. And I think that's the most important thing.
Okay, thank you. I somehow like this statement that we should not all talk about gender, but still I think we do have to help the young women in certain careers. So I also would like to talk a little bit what influences women when they choose their careers. What do you think should influencers like parents, teachers, governments do to encourage them and motivate girls and young women in male-dominated professions? Maybe
Okay.
Loulia, would you like to, or
Yeah.
any? Just
Well, I think it starts by parents. They into becoming a powerful and independent. There is a lot of back noise. I don't know.
yeah.
Heard clearly. And then maybe if I'm talking to the father, if a father of a family is a businessman, he owns a business, take your daughter for 1 week to work, give her some responsibilities, some tasks, let her let her get used to the business environment, let her listen to you closing deals or negotiating deals with customers. And maybe also, I think one of the most important things is to raise boys that will grow up into men that...
I actually cannot hear Loulia. I don't know.
Hi, do you hear me?
Yeah, we can hear you.
Okay.
Okay, I'm sorry. Maybe I missed the last few seconds. Somehow the connection was not so good.
All right, no worries.
Would you like to add something?
And maybe I would also add to raise the boys to actually have an open-minded vision of things, and to like for the men to talk to their sons and to maybe eliminate this gender bias that might sometimes be in the minds of young teenagers, I would say.
Okay, thank you. Manjunath, would you also like to add? Yeah.
Yeah, sure. So just to add, I completely agree with Loulia that everything starts at home. So, I'm also a parent of a boy and a girl. So I think first thing is to allow your daughter or son to follow their passion, right? Figure out what they actually like and then do it. And we also see some parents forcing science, forcing whatever other kind of maybe math or commerce or whatever, right? So identifying what they are good at and what they actually like doing, and then allowing them to follow that, irrespective of what is the scope of job or scope of making money and all of that, right? So that's very, very important. So same thing for women in science as well. I think parents play a huge role in terms of in making women choose the engineering or non-engineering. Okay, you're a lady, no need to choose engineering, right? Go for simpler, like say a school teacher or a bank job. These kinds of things should be taken off, should be based on the passion and the interest in the girl itself. And so parents, as I mentioned, play a huge role in that. And again, like Loulia mentioned, I think trying to bring in the gender equality at home as parents or siblings or whatever, right? So we can take up that role as well. And moving forward as well, I think teachers as well as everyone in the whole ecosystem should start treating that there is these are equal, right? I think that's very important. And some of the organizations, like even IEEE, has a special. I'm not saying we shouldn't talk about the problem. I mean, when I say we'll not forget about women, I'm not saying that we should not talk about this problem. Definitely, the problem exists, and we need to see how to kind of address that. I'm just saying, like, if you are a woman, doing engineering or any other activity, in order to contribute to your fullest, you need to forget the gender. That's all I'm saying. So, same way, some organizations like IEEE has a separate, organization like WIE, or even like some contests where only women are supported. Like some kind of specialized, activities and initiatives will definitely help and make sure that the equal opportunity is provided for women as well. just for the reason that the number of women engineers is much lower. I don't know the exact percentage, definitely less than 30% of the overall talent pool. So providing a separate opportunity will help bring out the nuggets in that section as well. That from that perspective, some of these scholarships for PhD, some of these activities can also be pursued, is my opinion.
Okay, thank you. I have one more question. So we all, or you all, have different cultural backgrounds. What do you see in other countries or cultures that you would like your community to emulate in terms of empowering women in science and technology?
I guess equality, in the way you look, especially like, when I go to US or something, right? It's so easy to just sort of go and say hi to a male colleague or like in a conference, right? And say hi and like, talk or like, on the breakfast table or at a dinner table. It's much harder to do the same in India. I mean, if you don't know the person, networking is a major issue here.
Okay.
You don't know, as opposed to, for example, when I go to a US conference, it's actually much easier for me to talk to male scientists of other countries very easily. We can do that because there's no such feeling. I feel there is no such major.
Okay. Loulia, what would you say about that?
If I would give an example of the Swiss startup scene, I can say that there are important efforts that are being done into filling in the gap between men and women entrepreneurs, because it's very evident, and I think the people in charge of the organizations or innovation bodies are aware of this issue, and they always try to put together organizations that bring in women founders and business women in order to talk to other women, to share the challenges, maybe give them tips, give them other contacts of other women who are coaching women in science in particular to become successful entrepreneurs. But of course, I think a lot of effort still has to be put in order for us to fill the gap and to have an equal scene, I would say, between men and women entrepreneurs.
Okay, so I think I would like to finish here. Ladies, thank you so much for all these insights, this answer. It was really very interesting. And I think we can now go further if there are some questions from the audience. Thank you so much.
Thank you.
Yeah, thank you, Ms. Silvana, for the panel discussion, and thank both the speakers for answering the questions. Now we will take the questions from the audience. First question is, can microwave engineering heal cancer? This is from Mr. Raghavan. The question is to Dr. Geetha Manjunath.
Yeah, so there are some, so we talk about multispectral imaging, right? And multispectral analysis. So where it's like the whole electromagnetic event, right? So different rays have different benefits. Now, when we talk about healing, we're talking about treatment, right? So yeah, for example, infrared can heal pain issues, right? I don't know if you've gone to some naturopathy clinics, you'll see that infrared gun being used, to heal knee pain and many other pains as well. So in the same way, yeah, so of course laser and microwave have been used for ablation, like, basically killing cancer cells, and that comes in the treatment. I've also seen some early work in trying to use microwave and ultrasound, to try and detect sort of lumps, right? Because you pass rays, it reflects, and if there is a hardness in the breast, it kind of, it doesn't go all the way. It gets reflected much earlier. So a combination of all of these different spectral rays have been used. But infrared is, we actually started off with it. We started off with a multispectral camera and looked at how the different ranges behave for screening. And then we found that infrared has the maximum recognition capabilities, I would say, and most importantly, it's completely safe, and that's what we decided to use. Hope that answers.
Yeah, thank you, Dr. Geetha. One more question is again for you only, for one small confusion at menopause time breast pain. How to identify, is this normal pain or symptoms of breast cancer? This is from Dr. Uma Reddy. This question is from Dr. Uma Reddy.
Yeah, hello. I kind of answered in the chat, but basically, I think it's called, so there are several reasons why a breast pain can occur for hormonal changes during, menopause, or even many other times, during a cycle, right? During a menstruation cycle, and nostalgia, I think it's called. So first thing is, there's no need to be worried about breast pain. It's completely normal. Even sometimes tighter clothing results in that. So nothing to be worried about. But I would sincerely ask everyone to go for a breast health checkup above 18 years of age. 18 years of age. 45 and above, mammography, but I'm not selling, but you could go for an ultrasound, or you can go for just a simple health check would always be good to get done, right? At least once a year or once in 2 years is absolutely required. Just so that, and typically cancer doesn't have pain, by the way, but it can be some inflammation or which may require attention. So that's important. Yeah, Sadhana.
Yeah, one more question is, how can medtech startups leverage their years of process orientation to be agile in repurposing their solutions for the unprecedented times? Maybe any one of you can take it.
Do you want to answer, Lydia?
Yeah. Yes, I can take that. So I think if your product has a very clear customer segment and the need for your technology is quite clear, I don't think there should be any problems in raising money in these unprecedented times.
Yeah. I just want to add, from a technology standpoint, for example, we talked about thermal imaging, right, and AI. So what we did was, we were working on this, breast cancer screening had stopped and so on, and we started looking at how can we adapt the technology to suit help this unprecedented challenge that COVID has posed. And so we, in fact, came out with what's called as automated COVID screening. That is just using thermal imaging and computer vision technology to detect faces and automatically say what is the temperature on the forehead, right? So we developed a software with thermal cameras again, which both our team is very good at. And within a week, we developed a software which can be used for automated screening for people who are entering into buildings like offices which are opening up after a lockdown, or hospitals where you have both COVID and non-COVID patients, right? It's not like it will detect COVID, but at least it can detect, sort of having that security guard come in and sort of, do the check with thermal sensors. So this we developed, during the COVID lockdown. And I'm happy to say that we do have commercial installations of that in multiple cities today. And we are going strong as well. And so this definitely, like Loulia said, we should not lose heart. We say, okay, what can I do with my own sort of, ingredients that I have, right? And then say, how can I address it? And also what we did was, from a company standpoint, you cannot stop breast scanning because, cancer will not stop because COVID is around, right? That's the hard reality. Same with other diseases, right? I just talk because this is something I'm involved in. So we have started what's called as home screening as well. So because it is completely radiation free, we said, why don't we take this test to instead of just putting it in a hospital, we can actually take it to individual houses. So we also made a go-to-market innovation, not just technology innovation, go-to-market innovation in saying that we will actually send people home. This is the first ever time that cancer screening is done, or the breast health screening is done at home, right? Because mammography machines cannot be taken home. So this is also, so basically, I think you just have to put a thinking hat and say, what else can I do? And definitely there are several opportunities to help people.
Yeah, next one is how can medtech startups leverage their years of process orientation to be agile in repurposing the solution for the unprecedented times? Yeah, this is over, I think. The next is role of mentors. Are they really needed? How to search for them? Did you have one? Maybe any one of you can take this.
Yeah, I already talked about it. There was a question on mentors before. Loulia, you want to add?
And mentors, yeah, I think if you have the right mixture of mentors, it saves you a lot of time and a lot of mistakes that you can do early on. I would say search for mentors that are, first of all, passionate about your product, that have experience in technologies that are similar to yours in the same field, I would say, and those who believe in your vision and want to push you forward, because I think it's really key to have the correct mentors in the correct time, because if you get them a little bit too far ahead, it's sometimes, I can say, I wouldn't say, of course, loss of time, no, but sometimes you learn your lessons the hard way. So you are lucky enough if you find them early on. I would like to stress on that. I don't know what Dr. Geetha thinks about that.
No, I agree. I think, like I mentioned before, I think mentor is not like you could have a person you go to for every time. That's one way of doing it. I always found that I go to different people for different type of problems. So that makes me like, I have the whole world with me. So, many of my senior colleagues are helpful. So it's very, very helpful.
Yeah, definitely. And maybe I would say, as you said, different sets of mentors with different expertise. It's always an add-on.
Yeah.
Yeah, next one is experience in startups. Freshers may not do well in product development. They are best employed for testing and ideating, HR side of things. Experience matters a lot. Please shed some light regarding your experience. Maybe any one of you can take it.
No, I feel, freshers come with a lot of bubbling ideas. You need to catch them. Like, nowadays, there's some of the schools have entrepreneurial skills as training, competition, contests, or whatever. So I've when I hire for a startup or my previous organization as well, it all depends on how you sort of ask the question, how do you interview. Of course, there are different grades or grades of talent you will find in all, whether experienced or freshers or whatever. But there's a fundamental smartness, a fundamental creative thinking on the foot, as we call it. If that's there, and then they're hardworking, and basically they're not saying that I know everything, they're willing to learn. And because that's very important, that whatever level of experience you have to be willing to learn, because technology is changing so much, right? So if you can actually catch these talented pool of freshers, engineers who are coming in, they will do great. And I really like to hire a fresh talent, because they do not come with any sort of back knowledge or whatever. I'm not saying experience is useless, then I will be thinking that I'm useless. But there's a different kind of positives that both groups bring in, right? In terms of overreacting, impulsive reactions versus very thought-provoking and thoughtful designs, and so on and so forth, is what an experienced person brings in. I think, again, you should have diversity in the team, have a mix of all the pools. But I don't believe that freshers need to be given only testing jobs. I used to think like that before, but definitely not. I've seen really, really smart people. And we do have many in my startup.
Yeah, thank you, Dr. Geetha. The next one is how not to start a business with a very high potential for growth with regarding to funding. How much to reveal while seeking funds, more of a poker play, never to give your game away to the VC or funding agency. Any one of you can take this question?
Loulia, please go. I'll answer later.
Well, of course, it's very tricky if you are an early stage startup and it's your first seed round, let's say, or the first time talking to investors. I would say never go unprepared. Always do your homework, study what it means to valuation of your company, how many shares you're gonna give away for how much, go early or unprepared because you might lose a chance with an investor that might have been interested. Always keep in mind that investors talk to hundreds of startuppers, and once you get the chance to talk to them, really use it. And then maybe also when you are starting to get funds, maybe talk to them before going to big VCs, and of course have your pitch deck reviewed by the trusted mentors and advisors before sharing it.
Yeah, so I agree with the points that Loulia made. In addition, if you're worried about, can I share my idea with them or not, and so on, I don't think you should be worried so much unless your idea is just 2 slides, right? Typically what happens is you wouldn't have done, you would have done a lot more due diligence, or a deeper diligence of the idea, right? You would have looked at what else others have done, how can I implement it, how can I make this happen, what kind of algorithm to be used, and so on. You don't need to reveal all of those things. What you can definitely reveal is a high-level idea of this is what I want to sort of do, right? For example, I think it's a brilliant idea what Loulia presented, right? Having a smart chip in a pad and so on, right? So just saying that I want to have this, no investor can actually take that idea and give it to anybody. If that's what is the question, like Poker mentioned, right? So, so really, because what I have seen is, investors are meeting thousands of other startups. They have better job to do than copy from idea from one person to another. So I don't think we need to be worried about. You have to impress them on what's the potential of your idea, and also the reason why you have to reveal some of the details is to show that you know how to solve it. It's not a 4-line slide deck, right? You need to prove to them that you have the brains and interest and talent to actually solve the problem with the solution, and also that the solution actually works, right? In order to do that, you have to go into details, and don't worry. I mean, if possible, you can do a quick patent filing. It's not very difficult, especially in Indian patent filing. I don't know if how many of you are already aware. You can do a Indian patent filing for less than like 2,500 rupees or something like that. So you could just do a provisional filing. There's something called non-provisional and provisional. You can do a provisional filing where you don't have to give a lot of details. But once you have filed it, it can be filed internationally within a year with a PCT and all that. So maybe if you feel that there is really something that I don't want to share with anybody else, go for a quick patent filing. And now Startup India program has especially if in India, for Swiss, there may be another platform to do that. So if it is in India, Startup India has, lawyers who are, who will subsidize that for you, right? That's how the 2,500 you will actually finish the whole patent filing, which is very, very reasonable. And once you do that, you can go and share with others if you feel that's critical. Yeah.
Yeah. The next question is to Ms.Loulia. The question is from Mr. Jayakrishnan. Have you tested this for tropical countries with higher ambient temperatures than your country? How is the affordability of this for developing countries? It's related to the smart pad. Huh?
Well, we are at the moment still testing it in Switzerland. We haven't proceeded to testing it in different countries. This is, of course, the next step. But of course, we are doing in the lab simulations to understand how different temperatures, different conditions might affect the functionality of the sensor. And could you please tell me the other part of the question?
Yeah, since the patent's already granted, how does cancerous growth differentiated from other tumor? This is for Dr. Geetha Manjunath.
Oh yeah, so okay, from a patent granted, I can share the secret sauce. Okay, fine, we can to some extent. So basically, what we do is we have some multiple stages. I think I put a sort of broad slide earlier. But just looking at cancerous growth versus non-cancerous growth, what we do is we kind of look at the thermal image and then separate it into three types of regions. One is a normal region, another is called warm spots, another called hot spots, right? How do we learn these thresholds? These are like some temperatures higher, lower, and all that. But these temperatures are learned using machine learning on a training set, right? What are the right temperature thresholds? Once you learn that, so now when you come to a hotspot, so the idea is every hotspot, cannot be cancerous. So how do you figure out the hotspot is not cancerous? So we have a patent which says, that we need to look at certain what's called a fractal dimension, that basically the jaggedness of the boundary, the irregularity in the boundary is actually sort of also modeled using image analysis technique, and then it's fed into a machine learning model. So, and like that, we have about 75 different features, but not all of them are unique. Some of them are statistical, simple, mean, mode kind of a thing. Some of them are very unique, like this fractal dimension, closer to ellipse, and some of these things. So once you sort of put the semantics in form of imaging, then you feed it into a machine learning model to actually identify whether it's cancerous or not. Also, we have a new algorithm to detect vascularity, that is blood vessel structure. So we look at warm spots, which are like tubular, in nature, cylindrical in nature, and then we sort of estimate that they can be blood vessels. And then we kind of majorly we compare the symmetry, like left side versus right side. Usually people get cancer first in one breast, and if it spreads to the other, it always happens after 2-3 years. And so we look at symmetry also as a very big, we have 35 different ways of modeling the symmetry between the two breasts in terms of temperature distribution, and the vascular symmetry and the temperature symmetry and several other such points, help us to finally make a decision.
Yeah, thank you, Dr. Geetha. The next question is to Ms. Loulia. This is from Veena Desai. Can you please elaborate on the type of parameters gathered by the smart pad?
So the smart pad has a custom fabricated microfluidic chip. It also combines immunoassay tests. It's capable of collecting the vaginal secretions of pregnant women. And to elaborate on that, pregnant women in particular have abundant vaginal secretions compared to other women. And of course, the chip is capable of collecting minimal amounts that can go down to 300 microliters. And the analysis is performed in less than 2 hours.
Yeah, thank you, Dr. Loulia. The next question is Bangalore where all the tests are carried out? It is from Dr. Uma Reddy to Dr. Geetha Manjunath.
No, we have actually done this installations in 60 plus hospitals in 14 cities of India. Bangalore definitely we are based in Bangalore, so we do have a lot of screening and centers here. I think some people even asked where it is. We installed in HCG, Narayana Hrudayalaya, Cloud9, and some of these sort of top hospitals as well as several others. What I would say is, like, somebody wants to know, like, go to a test or something, come to niramai.com. You say we have a page called Register for Screening. If you give your PIN code, our team will send you the closest location where this is available. We also conduct this camps outside the hospital, as I mentioned briefly before. So, for example, in corporate offices, of course, now due to COVID, we are not doing any group camps. Social distance needs to be maintained and all that. So, but before that, hopefully, after some months now as well, we go to a corporate office. There may be like 50 women, 20 women, whatever. We take a conference room, convert into a screening group easily, and again, nobody sees or touches the person during the test. So we give a 15-minute calendar, appointment slot, and people can come get their screening done and go. So, and it's available in 14 cities, and I don't want to reel out all the cities, but including Mumbai, Delhi, and Chennai, so and Orissa. So you please write to us, and I'll be happy to say whether it's available in your city.
Yeah, thank you, Dr. Geetha. The next question is to Ms. Loulia. What is the affordability of your product, SmartPad?
So we are still far away from having the pad launched in the market, as we are a medical device company. Every medical device, when being developed, needs years before reaching the market. Talking about regulatory approvals, to preclinical studies, to clinical trials. So for us, we don't have still a fixed price that I can share, but of course the price will be in the future customed to the different markets where the smart pad will be launched.
This is from a student. Are there any internship opportunities for students like me in your startup? If so, how can I apply? This is from a student, Reshmi.
Yeah, please do write to contact@niramai.com. We will review your resume. In fact, many of the IIT students are now doing remote internships. In like 2 people, we give projects and do it. We are at least having about 6 interns right now, 2 in Bangalore and 4 remotely. So, sure, we'll be happy to sort of support your interest in this.
Yeah, next question is also for you, Dr. Geetha. Is the NIRAMAI machine only for people above the age group of 45 plus, or can it be used for teens and 20 plus kids?
18 years and above. It's approved in India for any person 18 years and above. 18 years, adult lady.
Yeah, I think that's all. I think most of the questions are over. So, I think Ms. Sylvania, would you like to add anything?
No, it's okay. Thank you very much. It was very interesting. Thank you.
Okay.
Thank you very much. We enjoyed the Q&A and really appreciate the opportunity that IEEE and Swiss Network has given us to share the story and share our thoughts with the audience. Thank you, audience, for being patient. Thank you.
Yeah. On behalf of IEEE Bangalore Section and swissnex India, I would like to thank all the audience who have participated from both India and Switzerland. Then I would also like to thank both the panelists, Dr. Geetha Manjunath and Ms.Loulia, for having shared their experience with us and also taking all the questions and answering it. Then I would also like to thank swissnex for having collaborated with us. And I would like to thank Ms. Silvana, Deputy Counsel, for moderating the panel discussion. And I would also like to thank all the WAU Execom members who have worked for making this event a success. Thank you, one and all.
Thank you. Thank you so much.
Yeah. For the attendees and organizers, thank you so much.
Thank you.
Yeah. Thank you, Ms.
Bye-bye.
It was a pleasure to have you with us. And it was good to see a lot of Swiss students also joined the event. A lot of people from Switzerland have also joined the event.
Thank you. Thank you all.